Sometimes a quick summary isn't enough. Understanding the meanings of tolerance, dependence, and addiction is so critical to making informed choices about pain medication that we really need to take a longer, harder look at each, beginning with tolerance. Tolerance is really a very simple concept. The longer you use a medication, the more accustomed your body becomes to it. So after a while, you may need to take higher doses of your medication to achieve the same pain-relieving effect.
We're often asked about the tolerance that can develop as someone uses an opioid drug over time. All this means is that the body will eventually need higher and higher doses to get the same effect of the drug. This doesn't necessarily have any negative connotations, but it does mean that the person may require higher and higher doses. Some individuals fear taking higher and higher doses for fear of addiction. But what's being addressed is the tolerance of the body that can be essentially predicted as they use these medications over time.
The other part about tolerance is you can develop tolerance not just to the pain-reducing effects, but to a lot of the side effects. So you may take the medication and it may make you tired because of an adverse effect, but as you keep taking it, your body becomes tolerant to that and the side effect goes away. So tolerance can be is a good thing and a bad thing with regards to opioids, but we mostly see it in all patients.
When people take opioids, they can develop tolerance, which can be good for some things and bad for others. Good forms of tolerance may become that you become more tolerant to the side effects of opioid pain medications. For example, we know that a large percentage of patients that take opioids have feelings of nausea and they may have vomiting. But you may become tolerant to those side effects, or you may not become as drowsy from these medications as you once were. But it also tolerance can be a negative thing too. And what I mean by that is that you may have been able to take just a few pills before to get pain control, but now we have to give you more pain medications because they're not working as well.
Tolerance is simply a natural mechanism in the body that is requiring more medicine to achieve the same pain reduction as you had with a lower dose of medicine.
All tolerance is the natural process of your body adjusting to a medication. As your body adjusts, you'll find that side effects become less frequent and less severe. But for exactly the same reasons, you may find that your medication is becoming less effective at the dose you're taking. And that's not addiction. It's just the way things work in the normal course of drug therapy for chronic pain. We accept it, we deal with it, and we make the necessary changes in our therapy with the help and guidance of our healthcare provider.